No.
Chair, this government is committed to better, sooner and more convenient health care. And that's why Vote Health 2010 and 11 is the second largest vote in the budget, with appropriations sought totalling just over $13.54 billion. Can I say that again? $13.574 billion. All DHBs are receiving an increase in funding, and frontline services have been boosted. Frontline services are improving across the country, and we're also getting better value for that money. We saw, under Labor, money being thrown at health problems, but with very poor results. The health budget skyrocketed, but health outcomes went nowhere. Our government believes that it's only possible to manage what is measured. So, based on public priority, we've introduced 6 key health targets for district health boards. And just as importantly, all district health boards are required to report to the public quarterly on these health targets. There's nothing like transparency and accountability to make sure we get the best possible results and good value for money. Members may have seen the quarterly DHB reports in their local newspapers. They look like this. There have been 3 quarterly reports so far, so the public can now assess how their district health board is performing in the 6 key goals. Like everyone, I always want to focus on my hometown of Christchurch, and with many others I've been following closely what the Canterbury District Health Board has been doing. I can see their strengths, I can see where they're improving, and I can see their weaknesses. But now I and all other citizens of Christchurch and Canterbury know how our District Health Board is performing in comparison to others. I'm particularly interested in immunisation because it can protect our children, prevent a number of diseases, and is a very cost-effective health intervention. Immunisation provides not only individual protection from some diseases, but also population-wide protection by reducing the incidence of diseases and preventing them from spreading to vulnerable people. But some of these population-wide benefits only arise with high immunisation rates, depending on the infectiousness of the disease and the effectiveness of the vaccine. Under Labor, New Zealand's immunisation rates have been low by international standards and not sufficient to prevent or reduce the impact of vaccine-preventable disease such as measles and pertussis, which is whooping cough. So this government has made immunisation one of the 6 main health targets and is committed to a 3-year improvement program with a national goal of 95% of children fully immunised at 2 years of age. The target is staged, beginning with 85% of 2-year-olds be immunised by July 2010, 95% by July 2011 and 95% by July 2012. And there has been good progress against these targets since they were introduced. We have substantially beaten the 85% target due at the end of last month. 87% of 2-year-olds have been immunised, which is a vast improvement on the mere 80% that were immunised 2 years ago. In fact, it's a fantastic result. Better for kids, better for families, and better for our health system. We expect, with the added focus of collating stats by DHB every quarter, that there will be continued improvement and we will smash those targets. I can track these results locally by following the Canterbury DHB report. At the end of 2009, Canterbury had immunised 84% of its 2-year-olds. By March, 86%, already above the target, and at the end of June it was 89%. So I would like to congratulate the Canterbury District Health Board for a very fine effort of surpassing the target. This government is committed to better, sooner and more convenient healthcare. We are investing heavily in the sector.